Bang ding ding, trademark. He come out 6'7" tall. Bang ding ding, one is star. Bang dong ding dong ding dong ding dong ding dong ding dong ding. It is a perfect day.
Woke up to the sound of the garbage truck again. Upstairs neighbor's toilet's leaking on my head. And cars broke down, I missed the bus, there runs a 10. I had a feeling this was a day to stay in bed. I finally left my pad right on the jumbo's cloud road. A police officer pulled out his gun and said, I said, sir, you got the wrong guy. I guess it's just the perfect day. It's just the perfect day. Na, 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 na,
Hey guys, welcome back to Eggs. On today's show, we have Dr. Jeff Gusky. Dr. Gusky is a board-certified emergency physician currently on the front lines of the COVID-19 pandemic. In addition, he is a renowned National Geographic photographer and explorer whose discoveries and works are featured at the Smithsonian National Museum. Before we start, we kind of just need to do a little disclaimer and let you know that Dr. Gusky is a doctor, but his ideas and opinions are his own, and we are not claiming to be professionals in the medical industry. Ryan and I are creatives, and we just had a couple questions about COVID, and Dr. Gusky has a really interesting take on a solution. So now that we kind of covered our butts, please join me in welcoming our special guest, Dr. Gusky.
Jeff, how are you?
So honored to be with you.
Absolutely.
Great.
We're thrilled to have you here. So, I mean, Dr. Gusky is a really interesting guy. We were just having a little discussion prior to the hitting record on this, trying to make a decision what to talk to him about at greatest depth, because he's got such a breadth of knowledge and a breadth of experience in his life. We ultimately made the decision to lean on his expertise as an ER doctor, to talk about sort of the COVID pandemic, the types of information that are out there right now, and maybe what we could do to help maybe better protect ourselves from the impending virus. So, Dr. Gusky, do you mind just sort of introducing yourself, talking a little bit about your expertise and your background, where you're from, and why we're talking?
Yes, my name is Jeff Gusky. I'm a National Geographic photographer, emergency physician, explorer, and keynote speaker with National Geographic speakers. And I have once again stumbled onto something that is huge and have devoted my life 24/7 practically. I mean, every waking hour for the last 6-7 months to COVID. And it relates to a piece of this crisis that we're not seeing. And my orientation as an ER doc is very frontline and high integrity, high altruism, no business, no compromise, no corruption, we're living in this time where a medical crisis has been politicized. And we do not realize, people sense that there's something that's not right because we're getting so many conflicting stories. ER docs, we work in an environment where there is no political correctness. It's dangerous. We form intimate bonds with complete strangers in a split second. It's never black or white, gay or straight, rich or poor, educated or uneducated. It's just human. And so I combine that orientation, that way of thinking and living and being, with another background, which is as an explorer. For 25 years, I've been on the front lines of mass destruction and terrorism. And so I was the first fine art photographer to go behind the Iron Curtain and document a hidden world of the Holocaust. And more recently, the last 10 years has been focused on a hidden world of World War I. And the Smithsonian Institute focused their coverage of the 100-year anniversary of World War I around my work with an 18-month exhibit at the Air and Space Museum on the Mall in DC. And then more recently, I was part of a large exhibit at the new Smithsonian National Museum of African American History and Culture called We Return Fighting, the African American Experience of World War I. So there were two shows. And so why I mentioned this explorer piece is because what we do as explorers is to see things hidden in plain sight. And so I'd like to start this discussion, if we could, by helping your audience to see COVID in a different light. I hope that in a very short amount of time, that everyone will come away with new hope, with new clarity, and with tangible steps to stay safe right now. And then I want to tell you about something that is happening, which I believe will be a paradigm shift in COVID all over the world. It's actually happening right now in a small town on the Mexico-Texas border called Roma, Texas, where a community is rallying to be the leaders, the role models for the entire nation on how to reopen the economy safely and go on offense against the virus.
Yeah, no,
so,
I love that. Well, and it's great how you've introduced that too, because, you know, it's funny when we were talking before, and as I've read over the materials to prepare for the show and everything, you know, when I looked at photographer, explorer, and medical doctor, like I look at those two things and they seem so diametrically opposed. But then the way that you explained it more as this, you know, discoverer, or more of this, you know, this characteristic of exploration, the more it makes perfect sense that you would do both of those things. What makes you a great doctor, that inquisitiveness, that you know, intelligence, that look, or you know, puzzling for meaning, I guess, or trying to discover solutions to problems. You know, I mean, it's kind of the same thing. It just manifests itself in a different way. So thank you for that explanation. I love that.
Yeah. Jeff, can you kind of give us a quick breakdown of what's actually going on right now with COVID? There's so much going on with the election, with everything else, that COVID kind of has taken a back seat. And I'm seeing in Salt Lake, we're having huge spikes, and we're seeing it in small communities like in Idaho right now. And I've personally had people who have been affected by it. Can you kind of just give us a rundown of where we're at and what it's looking like?
No, it almost gives me a feeling of heaviness to respond to you, because but as an ER doc, we take patients and families on a journey through darkness to light and always towards hope. It's all about avoiding danger. And so I'm going to answer you straight, and it's going to be a bit scary. But it's not a manipulation. It's not political. It's not to sell anything. It's just telling people the truth. So yes, you're in Salt Lake and in Colorado, all the way down to Arizona, New Mexico, and up to Idaho, you're in a band of viral danger. And it has been obvious for months. We're looking at, well, let me tell you where we're at right now. America is exploding. It's been completely predictable. In fact, I wrote a document called COVID National Security Risk for the chief of staff of a prominent US senator on August 25th, before anyone was talking about COVID exploding in the United States. And no one listened. You can see the data. It's all very, very clear. Salt Lake City is one of these high-risk places. But we're talking, bottom line is that there is something that we're not understanding, that we're not looking at with COVID, that, in fact, a Draper, Utah company helped me to visualize, and it's called absolute humidity. So this is all about seeing danger differently. And there is a very easy to fix element of danger, which is now, and this is positive, hundreds of millions of people in entire nations have not been hit by the pandemic. Did you know that? No. People aren't really talking about it. Yeah. Perfect example is Hong Kong. And I'll go back. I just want to lay this groundwork so people feel hope and not to get freaked out, because when you hear what I'm going to tell you in a moment, it's going to alarm you. So Hong Kong and New York City, about the same population, same landmass, both sophisticated places, both received planes and people coming out of Wuhan at the beginning of the crisis. New York City has had over 24,000 deaths and a death rate of about 2,800 per million. Hong Kong has, as of this morning, lost 105 people, 105 total since the beginning of the crisis.
Is that just a breakdown in the how can they prevent it from spreading in such major markets? What's the defining factor between the two?
It's very simple. And virologists have known about this for a long time. It's really scary because none of this is secret. It just requires what an explorer does, where you piece together disparate things, pieces of a puzzle, and then you see it. And so the difference is in something called cell-mediated immunity, which is a form of herd immunity that no one's talking about. So can I just go down another little tangent and then loop back?
Sure.
So because the only thing that's going to protect us, and the reason why some of the poorest places on earth, like Bangladesh and Haiti, have amongst the lowest rates of COVID. They have no money, no social distancing, no high tech, no medical infrastructure like the Western world, but they have the lowest rates. Now, why is that? It's about a form of herd immunity that's protecting them. So what is herd immunity? It's when enough people in a population are immune. And it's like a firewall. The virus cannot spread like wildfire. So yes, you can spread. One person can get it from another person. That's still possible. But in terms of the fear that we're all fearing, which is why we shut down America, it's mass spread. That's what would break the hospital infrastructure. That's shuttering the economy, and it's frightening everyone. And so we've been hearing about vaccines and herd immunity through inoculation, which is a different branch of the immune system. That's called acquired immunity or humoral immunity, which is a learned immunity, where you either have to get the infection or you have to get a vaccine to inoculate you. And hopefully these vaccines will be out there looking very promising. It's amazing. It's a high-tech wonder what has happened, what's about to happen. The problem with humoral or acquired immunity, or it's also known as adaptive immunity, is that we don't know how long the antibodies will last, one. So just like with flu, there are mutations that happen, and we have to do a new flu shot every year, and it might work 50%, 50 to 70% if you're lucky. And some years it doesn't work very well at all. But it's a moving target that you're following with a flu vaccine. Some other types of vaccines like polio last a lifetime. So we don't know what we're dealing with. We do know that some people are getting the infection again, even after they've had it. Not very often, but it's possible. The other thing that we know is that in the last 5 days in Denmark, there has been a mutation that's very alarming because it jumped from people to the mink industry. They have 17 million minks.
They just mutated a bunch of them, didn't they?
Yeah, I believe so. At least they were talking about it. And they've certainly shut down the country. And the problem is that in animal reservoirs, like mink or badgers or other types of animals, the mutation cycle may happen faster and it's jumped back to humans in a different form, which the vaccine may not help with. So it's possible, I hope not trying to be a purveyor of gloom, but we have to be open to all the possibilities. And I want to remind people there is hope in what I'm going to share. So the problem with humoral or acquired immunity acquired through a vaccine is that it can be temporal and it can be bypassed with a mutation. There is a different form of herd immunity that no one's talking about, which is called cell-mediated immunity. And it's a very well-established form of immunity we don't know about because it's never really mattered.
Can you tell us a little bit about that? Is that what
Very
happened
simple.
in 1918 with the original?
I don't know.
Yeah,
I don't
I've
know.
heard that herd immunity is kind of what caused that to all go away. It's not like they had a vaccine back then.
No, it did. Yeah, but you have to remember that was probably acquired immunity because enough people got infected that you have a firewall because people became immune.
Okay. What's the difference between that and what you're talking about?
Okay, very good question. Cell-mediated immunity is not a specific immunity. It doesn't have to be learned. It kills everything. It kills on sight. So it will work against COVID as it is now. It will work against COVID in a mutated form. It gives us a backstop against uncertainty. So we want the vaccine, yes, but this is why hundreds of millions of people right now are not getting hit by the pandemic. For example, Thailand, 70 million people. As of today, they've had 60 deaths. 70 million people, 60 deaths.
That's insane.
Taiwan, 23.8 million people, 7 deaths. And what do all these places have in common? Indonesia, Malaysia, Philippines, Haiti, the Caribbean, they all are in tropical climates where this metric called absolute humidity, which no one's ever heard of and which we could not measure until on August 3rd with the cooperation of a wonderful small company, a startup technology company in Draper, Utah, called Purple Air. They helped me to implement my vision of something called the Viral Safety Index, which is a colorimetric visualization of real-time viral risk indoors, inside buildings where COVID spreads. So back to the issue of cell-mediated immunity. So it's a type of immunity in our respiratory tract that it just attacks everything, but it has to be turned on. And there are two things that are critical to turning on cell-mediated immunity. Now, everybody's probably wondering, why don't we know about these? That's a very good question. And I don't do the conspiracy theory thing,
well,
but
yeah. I mean, it's funny to me because as I'm hearing you describe this stuff, I'm going, okay, well, I've never heard of that. I've never heard of this. I've never heard of that. And the cynic in me starts going, oh, okay, well, it's big pharma. It's, it's politicization of things. It's, all these other things, and so we're not hearing, about these alternatives, and it really is interesting,
This is, we do not even have to get into the politics of it. All I can say is that there's no money in this. And that I'm sure that may be a factor because we're talking about humidity. We're talking about inexpensive humidifiers in buildings and homes. Many places already have that capability. You don't have to spend a dime. And we're talking about vitamin D that you buy at the grocery store. And those two things turn on cell-mediated herd immunity. So for whatever reason, and I can tell you that there are many peer-reviewed papers in the virology literature in particular. One that is really troubling is from the Proceedings of the National Academy of Sciences from 2009, where an esteemed virologist named Dr. Jeffrey Shaman, as the lead researcher, advises nursing homes to humidify indoor air in order to protect patients at risk from mortality from viral respiratory infections, flu mainly.
Well, so what is it about the humidity that helps that? I mean, in my mind, and obviously I know nothing about anything, but my assumption is that maybe helps trap the virus or keeps it down or something like that.
I mean, there's all kinds of. It's not. It's there's a complexity to the answer, but we don't need to go complex right now. There's a lot that we won't even know for a while. But what we know with clarity are these numbers that I'm telling you. That we're not hearing about, where hundreds of millions of people are being spared. And so it's simply this. And now first, let me sidebar again. Absolute humidity is the key. It's not relative humidity. Throw relative humidity out the door. Absolute humidity is simply the amount of water in the air. It's measured by weight per volume. So it's grams per meter cubed. Absolute humidity is not something you can see on the weather report. There is no device you can buy on Amazon for any amount of money to measure absolute humidity. There is a device that is a very specialized device. I'll show you. And I bought one of these back in the spring from an industrial supply place. It's called a Testo 645. Okay, so until I had this, there was no way to measure absolute humidity. Until August 3rd, there was no way for anyone to measure absolute humidity except to physically go into a building with a device like this that no one has and you can hardly buy. And you can't even buy the data on databases that I know of. Imagine this. We have a global crisis like we've never seen before, and it's being caused by a metric that we cannot measure, that we cannot see, and that no one's heard of. It's mind-boggling.
Yeah, it's pretty incredible.
Yeah, so it's all over the virology literature.
So I lived in the Philippines for a while, and so I know how humid it is there. You take a shower, get out, dry off, and you're just as wet as when you start drying off. It's horrible there. Houston is pretty similar as far as it's very humid, kind of not.
I'm
as
glad
bad.
you brought that up.
That's what I was getting at. Is that the difference?
No,
is Houston not okay?
So that's why we've got to throw out all of our preconceptions about humidity are actually endangering us. So Houston and New Orleans and Seattle, perfect example. So the first nursing home to get hit was outside of Seattle in Kirkland, Washington.
Yeah.
The French Quarter had a big outbreak, remember, during Mardi Gras.
Yeah.
And Houston blew up in June, late June and July. And all of these places, you think humidity until you can measure absolute humidity. And then, oh my God, it comes like a thief in the night. It can happen. In fact, it often happens on gorgeous days. It can happen in the winter, in the fall, the spring, and the summer. It can happen day and night. It can happen when it's raining outside or sunny, because it is a metric that is not relative humidity, which is the capacity of water in the air. It's the amount of water, which has a lot to do with barometric pressure, which we can't feel. Mm-hmm. We don't know when a weather system comes in. So yesterday morning in Dallas, where I am, it started out, in a very safe range, which is above 10. Let me just mention this number. And this is really hopeful. So the data there's a lot of data. This is not a controversial data point. When you are breathing air indoors that is 10 or above, meaning 10 grams per meter cubed and above, hotspots all but disappear. So COVID mass spread essentially does not happen when you're 10 and above. 10 or below 10 is where it happens, and it's 8 to 9 or 8 to 10 is moderate risk. Below 8 is high risk. And so these places like Kirkland, Washington, where the nursing home happened, those people were breathing air that was 3 and 4. Wuhan, last December when the bomb went off, was 6 to 7. And the lower you go, the higher the risk. It's inverse. So New Orleans on Fat Tuesday of Mardi Gras was like Wuhan, outside. And inside, it was worse because when you pack people into restaurants and bars and have commercial grade air conditioning going, that pulls absolute humidity out of the air. Doesn't happen in the winter with heat. Heat does not dry the air. I know that's counterintuitive, but it's just because absolute humidity in the wintertime is often low, which buildings breathe. When it's low absolute humidity outside, it makes it low inside, and people they think it's from the heat. It isn't. But in any case, back to New Orleans. So air conditioning, low absolute humidity outdoors, disaster, because those people were breathing worse than Wuhan air. Houston, the same thing. In the summertime, we had a dry spell come through in the most humid part of the year, and boom, COVID exploded throughout Texas. So yesterday in Dallas, perfect example, it started out great, and then just by happenstance, I happened to look at the equipment, the viral safety index, which I'll tell you about in a second. And oh my God, everything was upside down. It was now 4 and 5 outside in Dallas. Remember, 6 to 7 is Wuhan, lower is more dangerous. I went to the grocery store last night and I carried with me, and everyone should do this. This is an inexpensive digital hygrometer. This one is made by Gobi. I have no commercial ties with this or anything I'm talking about today. And it's $12 on Amazon. And I carried it with me to the grocery store. And the grocery store was in the 30s. You do not want to go into a public building unless it's 50 or above. And this is measuring relative humidity, but that's the best we can do unless you have a device like I showed you a moment ago, the Testo, and the people don't. So let me go back. Let me just try to knock off a couple very important concepts here. One is that why absolute humidity affects cell-mediated immunity is that it turns it on. When you breathe moist air, you're safer because there are a complex set of variables that are turned on by, in fact, there's an important paper by Yale in a prestigious journal. It came out in March of this year that explains it all. And if people go on to the city of Roma, click on COVID-19, and you'll see the page about visualizing hope, showing America how to reopen safely and go on offense against the virus. And there's a clickable link to that paper. And everyone can read it. It's very geeky and technical, and don't expect to understand a lot of it. But basically, you can read with your own eyes. They're telling you that dry air causes devastating clinical outcomes. Those are their words. And so we're talking about absolute humidity, not relative humidity.
Okay, so I wanted to ask you then maybe, and I think this is sort of what you're alluding to, but so what does the absolute humidity do to our bodies that makes us more resilient? And I'm thinking anecdotally, but like, for example, when my kids are sick, we run the humidifier in the room, right? We just do it because that's what mom always did, right? But
right.
I mean, it seems to sort of play into this dialogue. And I'm even just thinking sort of the opposite, right? I mean, we've had a shift in temperature here in Utah where we went from 70s and 80s to suddenly like 30s, 40s.
Yeah.
And so it's gotten real cold, real fast, and real dry. And then now all of a sudden here our numbers are going up too. So
it was there. Your
purely
risk was
anecdotal, but I mean,
No.
I'm just wondering if there's some correlation there.
There is. Great point. So yes, mothers and grandmothers and great grandmothers had it right. They knew the old fashioned ways about bringing a humidifier home when you have a new baby. There was science behind that. People didn't know it. It was empiric, but it worked. And the reason is that it turns on the cell-mediated immunity, and people are healthier. So Salt Lake, and in fact, if you go on to the Roma website I was telling you about, you can click on the viral safety index and for Roma, and you can toggle or you can move to and see Salt Lake right now. And it doesn't look good. It's bad. But you can also go back historically, and you can see that the danger was happening over the summertime when it was hot outside. It has nothing to do with temperature. It has everything to do with the amount of water in the air we breathe indoors. So let's get really clear about the model. This is so important for people to feel peace of mind about why COVID mass spread happens. You need virus and you need vulnerability. Those are the two things, virus, vulnerability. Okay, so virus has to be in a specific form. And so it's airborne, but there are two types of airborne spread. One is microdroplets, and the other is what's called aerosols. Now, what's the difference? Size matters with COVID spread. Both are invisible, but microdroplets are hugely larger. I mean, they're enormous compared to aerosols. So microdroplets are like throwing a baseball, where you have velocity, mass, inertia, and they go from one person to another. And you can, like with a baseball glove, a mask is, you can block a microdroplet, or at least a lot of them, with a mask. Microdroplets will sink to the ground with gravity. So social distancing, the idea is that you get far enough away from it and it won't hit you because it will fall. Microdroplets, you can clean surfaces, you can wash your hands, you can have protective barriers. Well, none of this is working. And we knew it over the summer because COVID started to blow up in Europe, where they have been doing all of this stuff obsessively. They're more socialist there. I've spent a lot of time in Europe, very close to France, with my work on World War I as a Nat Geo photographer. And they still don't understand why. But I can tell you that 30 countries in about 7.5 weeks exploded to new all-time highs. America exploded to a new all-time high on October 23rd, about 2.5 weeks ago. And it's going like this. So it turns out that the reason I believe that COVID mass spread occurs is very simple. And there's been an outcry by 239 aerosol scientists from 32 countries, wasn't political, was pleading with the WHO to recognize the aerosol mode of spread. And this is why you can see it's been so politicized. They basically shut it down.
Can you break
so what
down,
are aerosols? That's
what I was just getting at. Can you break that down for us?
Aerosols are, yes.
Okay.
So, we think of hairspray and aerosol cans. And okay, so forget about that. Aerosols are a cloud. They are submicron particles that are smaller than a mask can block. So you can't block them. You can't distance them because they don't float, or they don't fall by gravity. They just float. You can't, a plastic barrier will not separate you from them. You cannot wash your hands and get rid of them, because even if you wash your hands like a surgeon will do before a procedure and don't touch anything, the cloud of virus is everywhere and it will reaccumulate on your hands. So you cannot distance, you can't quarantine, you can't, or let me take that back. You can't distance, you can't block, you can't clean.
Well, it makes sense, right? I mean, if you even just were to equate it to something much larger, but let's say pollution or particulate matter in the air, it just sort of is. It's just kind of all around you.
You remember that's a great point. You remember the Sahara cloud that went all the way across from Africa to the United States this summer?
Yeah.
Mm-hmm.
That was an aerosol. They float. They don't obey the laws of gravity. They're so tiny.
Well, so what creates the aerosol? So you think of it, you said the examples of, like an aerosol spray paint can or something, but so we're forcing it, we're creating an aerosol. But how is this aerosol happening?
When someone with COVID breathes, they emit a a cross section of types of particles. Some are micro droplets, but there are a significant number that are aerosols, submicron particles, and we're talking about millions and millions of particles from one person. So picture this: picture COVID as a cloud, and so it comes from one person. And that cloud floats for hours to days. It can go hundreds of feet across a room. Let's say you're in a stadium, a convention center. It can go all the way across the other side of the convention center. It can go down halls. It can go around corners. It can go through the ventilation system, floor to floor. It's scary. And you have to assume, like I did so stupidly last night, going to the grocery store with, knowing I was in danger. And, we don't, none of us, even me, and I'm living with this all the time, can wrap our heads around this new reality that there is a risk that we don't understand, which is that COVID is, as a cloud, we cannot sterilize buildings. It's a myth. So going back to virus and vulnerability, you need virus as a cloud, and the only place that happens is inside interior spaces like buildings, buses, trains.
And is that just because of lack of air movement, for example? So you're outside, the air's moving around, it breaks up these clouds.
It's much more than that,
or something.
It's the atmosphere is a massive dilution. It dilute immediately. Aerosols dilute, and so you can be vulnerable outside. Let's say you're in Arizona or in Salt Lake. I bet that if we looked at the viral safety index right now, Salt Lake is probably 2 or 3. Remember, 6 and 7 was Wuhan. You're probably more than double the risk of Wuhan in Salt Lake. And if it's that low outside, it's that low inside, unless you add humidity back.
Okay.
Sorry.
So you add a humidifier to the equation and everything's okay?
Yeah, let's come to that. It's really simple. But let me just make these points. So you have a cloud of virus. There's no way to block it, to clean it, to separate yourself. The only thing you can do is to lower vulnerability. And if you lower the vulnerability for everyone in a building, that is a form of herd immunity. If you're in a nursing home, and because everyone's breathing the same air, even if they're really at-risk people in terms of their underlying health conditions, absolute humidity turns on cell-mediated immunity, and everyone is immune or relatively immune, much less at risk. And that prevents COVID spreading like wildfire. Turns out vitamin D is critically important to cell-mediated immunity as well. It's mind-blowing. And doctors don't know about this, by and large. I did not know I've never ordered, I'm an ER doc, in 30 plus years of practice, a vitamin D level. You never think about it. Vitamin D is about postmenopausal women and bone density. We don't deal with that in the ER, at least on an acute basis. Well, it turns out that with COVID, because vitamin D turns on cell-mediated immunity, it's critical. If you go into a hospital and are low on vitamin D with COVID, you have some studies show, and they're very high statistical significant studies, you have up to a 96% chance of never coming out alive. Just from a darn supplement that you buy over the counter at the grocery store.
Well, so that's what I was going to ask is, what's this combination? So we've got absolute humidity plus vitamin D is where we need to be. Where do people find vitamin D in nature? So, I mean, obviously you can get it at GNC.
Vitamin D, it's sunlight.
Yeah. Is that
you can't get
is
it
that
from
why
the diet.
these tropical places, for example, tend to have more
Well,
vitamin D?
Yes, but it varies because if a lot of these people, like in East Asia, in Bangladesh or Haiti, you have people of color, and so vitamin D for all comers, the entire population of the U.S., 42% level of deficiency. If you're Hispanic American, 70%. If you're African American, 82% of African Americans are low on vitamin D. They don't know it. None of us know it. You can't feel it. You can't. I've been taking vitamin D for 20 years, 2,000 units a day. About 4 months ago, I increased it to about 4,000 a day. I got my levels checked a number of weeks ago. I was dangerously low, and I work out 7 miles a day. You cannot know it. You can't feel it. You have to get tested. And the level needs to be 50 to 60. And that's nanograms per milliliter. NG, like National Geographic, nanograms per milliliter, 50 to 60. It affects children. It affects adults. In particular, elderly, anyone that's confined, that's not, sunlight. If you're outside without a shirt and working for several hours, your body can produce up to 20,000 units of vitamin D. And so the levels that we're taking are not enough. But what I'm advising people to do is it's a program, and I'm hoping to get corporations to sign a pledge, get started, get tested, get right. We can't wait for all of the bureaucracy. We have just got to do this thing. And corporations and school systems and municipalities, big organizations need to sign on to this. Everyone needs to start taking vitamin D today. And I recommend 2,000 to 4,000 units. And that's, I'm not giving medical advice. That's all over the medical literature that it's safe, and, from places like the American Endocrine Society. So you can start right away, take 4,000 units if you're an adult, and get tested as soon as possible. You can go online and buy a kit on Amazon for $69 with free Prime shipping overnight. And you want to be 50 to 60. If your doctor tests you and the nurse calls you and says, "Oh, you're fine," don't accept that, because all that we do, we're all so busy in medicine, we look and see if there's not an outlier, on the lab parameters, we say, fine, don't worry. But in fact, the lower limits of labs are 30 and 20. So you need to be 50 to 60. The maximum benefit is at 55. So let's go. I just want to, there was a point I was going to make about, what was it? On cell-mediated herd immunity. So it's very simple. It's something that's turned on when you're inside a building. So picture, I want to just give you several examples so you have this idea of virus and vulnerability. So, for example, in an airplane, there have been no documented cases of mass spread on airplanes. And they've known about, this is an example of the politicization of this information. The CDC has known about this for months. And, I talked to the vice president of safety in a one-on-one in-person meeting at American Airlines headquarters, and asked him the question, asked the leading editor-in-chief of a aviation industry publication the same question: do you know of a single example of mass spread in airplanes? They both said no. And that's why American Airlines is packing their planes, because inside a pressurized aircraft cabin, when you think virus and vulnerability, so you're very vulnerable, because when you're up at altitude, the relative humidity, or let's say the absolute humidity, is very low. It's like 2. It's like Salt Lake is probably right now. It's very, very low. And your cell-mediated immunity isn't working. But guess what? There's no virus, because with airplanes, the entire cabin air is flushed every 2 to 3 minutes. It is exchanged, and it goes through HEPA filters. So that's why you don't have virus. You have vulnerability, no virus. Let's go to a situation like Sturgis, the big motorcycle rally.
Yeah, that caused a big spread, didn't it, for the most part?
Yeah, or you can look at, there's so many examples that Arizona,
the beaches in Florida. I saw a
not
visual.
The beaches. No.
Really? I saw a spring break thing a while ago where it was, you could see the phones and you could see where they left from. And that was just mind boggling to me to see that kind of visualization of, this is where this person was, this is where he's at, this is the outbreak now. And
okay, so that's the danger of not understanding the model and politicization. because it creates all of this confusion. This is why, basically Europe and America right now, we're all being led over a cliff with all these safety measures that aren't working. And we don't have to argue. It's not right or left. COVID is exploding. These things are not working. End of story. We don't need to argue. We need to ask questions. So here's what happened in Florida. Florida had an excellent safety record going into the end of May. They were predicted to be a disaster because they have the highest concentration of elderly people in the country with all the nursing homes. In fact, they were a role model for how you protect elderly people in nursing homes. But they also have high absolute humidity outside. It's not like the Philippines, but it's around 15, 18. It's up there, and that makes the indoor air, even with air conditioning, safer for nursing home residents. What happened with Florida is, and it's so amazing, you just go on the Johns Hopkins Coronavirus Resource Center, you can see the graph. So in May, the shutdowns are starting to end. People are cooped up. Young people want to party. They want to get out and have their life back. They go to Florida, and you have tens and tens of thousands of people descending on Florida and bringing with them virus. So you have critical mass, just like with Sturgis, critical mass, all these people coming to one place. And where do they go? Bars and restaurants. Now, here's what happens. You absolute humidity indoors. And so remember, outdoors, it doesn't matter because the cloud, you don't have virus outdoors. Cloud dissipates. So there's not a single documented spread that I'm aware, or not a documented case in the world literature where you have COVID mass spread outdoors. Zero. Why don't we know about this? Look at this has done to the restaurant industry, to tourism, so many, our whole way of life, 4th of July. Well, this is known.
I'm actually in the industry. I'm directly affected by COVID, and I've been out
We
of
ought
work.
to talk about this.
Yeah.
I'm off, by the way, just to put in a little plug, I am doing consulting services for industry, and especially with what's coming with Roma, which I'll tell you in a second, this visualizing hope. It's so cool, and I'm happy to help. But imagine with your industry, imagine the job losses, the suffering, the businesses that will never be reopened because of data that has been known but not shared. That's politicization. That is malicious. It's not American. It's un-American, and we will look back on this time, and people are going to be, their head is going to explode. Because this has all been known. Same with airplanes. They've known there's no mass spread on airplanes. And an industry has been destroyed. Tens of thousands of jobs gone. When in fact, an airplane is one of the safest places to be during the COVID crisis.
So can you kind of just give us an overview of how someone like a concert venue or a small bar owner or a restaurant owner can implement some of these things that you're talking about and maybe save their business?
Very simple. So simple. Go on City of Roma. Roma, it's R-O-M-A, Roma, Texas website. Click on COVID-19 and you'll see a complete explanation of what we're doing. So we are installing this visual network of viral safety using what I call viral safety index sensors. They are sensors that are very inexpensive, about $250. I don't have any commercial tie to the company, and we may develop another line of specialized sensors outside of Purple Air to do this. But in any case, you put this sensor in your bar, your restaurant, and it measures in real time absolute humidity, and it's colorimetric. So when it's green, it's 10 or above. And here's what's really cool and this is what is happening in Roma right now as we speak. Imagine every mother, before they put their kid on the school bus in the morning, looks on their smartphone to see that the air is green inside the school, that it's 10 or above. it is a way to go on offense against the virus. It's a way to revive hope, because when we can see the enemy, we can turn into the storm. We can fight this. And the enemy is dangerously low absolute humidity. So you can do a sensor, or you can do something very simple on an interim basis. You can buy a bunch of these hygrometers, again, $12 on Amazon, and then check to see if your HVAC system has the capability to regulate humidity. A lot of them do, where you just set it and forget it. You turn a dial, and I would turn it to 58. So what are we talking about there? If you go inside DFW Airport, which a lot of us has been through, Dallas-Fort Worth Airport, Love Field Airport, the elegant North Park Mall, the Methodist Houston Healthcare Center, the Collin County Detention Center, which has had no hotspots, 1,300 bed capacity jail north of Dallas. All these places, and it's based on ASHRAE guidelines, which is the American Society of Heating, Refrigeration, Air Conditioning Engineers, run their humidity in this range that is in the safe zone. They don't even know it. It was long before COVID. They've been doing this for years. So you want to be around 58%. And that is likely, if you're 50, as close to 60 as you can get. You don't want to go too much above 60 because you can get into black mold. But in the 55 to 60 range, you're cool. It's totally safe. It's comfortable. It's wonderful. It feels good. And it will mitigate hotspots.
Well, so I wonder, go ahead, Mike.
So say, for example, you have this option to humidify with your HVAC system, and you want to have a concert with 1,000 people. Could that regulate something like that, or is that industry
Absolutely.
just gone?
The opposite. The industry is it's so right in front of our eyes. It's right under our nose. It's there. And here's the evidence of that. So Japan and South Korea have extremely low numbers. So Japan, 126.4 million people. Our death rate in America is like 762 per million as of this morning, if I'm not mistaken. Japan's is 15 per million. 15. And they are in an area which in the wintertime is worse than Wuhan. It's like Salt Lake. It's dangerously low absolute humidity outdoors. Yet for years, they have been using absolute humidity in their public buildings, and in particular, their healthcare facilities. It's that simple. And so what we need to do is a grassroots movement. That's what Roma is doing right now, to reopen safely and go on offense, to give people hope. And it's simply a matter of making the indoor air we breathe in that 55 to 60 range around the clock. It's so simple. Now, let's say you don't have an HVAC system that can do this. What you want to do is this. Go out and you can go on Amazon or Home Depot or Sears or lots of places sell these. It turns out there's one company that makes what are called whole home humidifiers that are portable. And they cost from about, 50-ish up to like $150 or $170, if you buy it online. You want to buy an evaporative, not an ultrasonic. And you want to buy one that covers the square footage of your home. Now, they'll say covers 2,500 square feet, cut that in half, or 3,000 or 4,000, cut it in half. But the model I would recommend is an MA1201. I have no ties to the company. And that's what I'm using at home. You pour the water in, you put the setting on 65 auto, and you forget about it. And you also want to buy some bacteriostatic solution where you put a little capful in the water to prevent algae or mold. So that's it. You want to keep the air 55 to 60. Buy yourself a hygrometer. And if you want to market the safety, you do what Roma is doing. And this is free. So what soon will happen is that people will look at their smartphones to see if a restaurant, a bar, a hotel, a concert venue, a hospital, a nursing home, a school, a retail store, a barbershop, etc., if they're green, because you can look and see before you go in that the air is safer and lower your worries about COVID mass spread. And so what this does is it uploads in real time the location of the venue for free. And everybody you can just click and see, oh yeah, there's, so and such restaurant and they're green. And, the economy is going to explode in a positive way, in a great way. People so want their lives back. And by breathing safer indoor air and getting your vitamin D levels to 50 to 60, those are the lion's share of what we need to do. Not all this other stuff.
Well, yeah, and that's what I was going to ask is sort of, we've painted this picture. We've talked even a little bit about what, corporations or like in Mike's case, the restaurants and bars and how maybe they could react by implementing this technology. Can we just talk a little bit more about sort of the individual, right? So, you mentioned these in-home devices that you can get, or if you have an HVAC system that will run it. But like, I guess if you're trying to mitigate your risk, or I guess who I'm thinking of are sort of the work at home types. And to give you an example of just me, basically, I've not left my house since like January, more or less. I run the kids to school, I run to the grocery store, I do a couple little errands, but largely I work at home, I live at home, I do all this stuff at home. I have noticed that by 4 or 5 o'clock in the evening, most days, I start feeling a little cruddy, as if I've got, cold symptoms or something. And it's been going on for months. So I know it's not like COVID centric, but I wonder if it isn't tied to this vitamin D and sort of lack of sort of humidity in our air. We have a Nest at home and it says our relative humidity is at 35, which based on what you're telling me is very, very low. And so, and I've thought about buying some, systems and things like that to put on our HVAC system that might humidify the air a little bit.
Yes. That's what you need to do.
Well, and so what I've done is I bought a Dyson fan that, has a HEPA filter and stuff to try and purify my air in my office.
Yeah. No,
and,
that's not it.
And I was going to say it's not working. And so, but I'm wondering if, sort of these anecdotal things that I'm.
Ryan, you there? I think we lost him.
Okay. Mike, can I answer Ryan's question?
Go right ahead.
Okay, so very simple, very, very simple. So he mentioned the sense of exhaustion, the sniffles. So yeah, a lot of people seem to, I don't know what the data is. I do actually, there is data about this, but in essence, when you breathe moisture air, you're more comfortable. And with regard to COVID, you're mitigating the mass spread. So why do people need to do it at home? You want to be breathing moist air all the time. And it will be something that you'll want to do going forward because it not only helps with COVID, but it helps to lower flu risk, colds. It's just a general safety measure that we need to do. But with COVID, it's life and death. So 3 things that you can do. One, if you have a modern HVAC, you may have the capability to just turn a dial. 2, if you don't and you want to just set it and forget it, not have to put water in and clean filters periodically, etc., or add bacteriostatic solution, you can buy whole home humidifiers that attach to your central air. And you need a plumber or an electrician to hook them up. There's a little expense there, or maybe if you're a handyman, you can do it on your own. But you can get devices that will cover like 5,000 square feet for $600-$700, and down to the high 100, 200 area. One of the companies is Aprilaire. But you have to make sure when you buy one of these devices that they have the capability to carry the humidity up to 60%. A lot of the Aprilaire equipment right now only goes into the 40s, and the same with others, Honeywell, and because they're oriented towards a different time before we knew about cell-mediated immunity and COVID. So Aprilaire does have the capability. There's a model 801, I think, with a special controller, and you can run it up as high as you need to. And I think it's probably around $1,300 to install on an HVAC. The third step is if you don't want to either put a system in or if your system doesn't already have it, is you buy enough of these whole home humidifiers, and I would do it today. And the one I would buy, the most bang for the buck, is this MA1201, which is by Air Care or Essic Air, the same company, and it'll cover about 1,500 square feet. You might need 2 or 3 or 4 of them, for all I know, depending on the size of your place. But go out and get them, and it's that simple. And you buy an inexpensive hygrometer. You place the hygrometer away from the humidifier, because the humidifier will give you a false reading. It's only reading what's the humidity around the humidifier, but you want to get the actual humidity, on average in your space. So you put the hygrometer at 15, 20 feet away from the humidifier, and then you know what the actual humidity is. And if you just run that all the time with the MA1201, you can set it and forget it, because it goes on auto. It senses when it drops, even if you're sleeping, and it'll turn on. It's that simple.
Yeah.
And then get your vitamin D level checked.
I just looked on Google, and there's a ton of options. Home Depot has them. We'll put a link to this product on our website when we upload the episode. But they're about $130. And if this is all it really takes, and some vitamin D supplements, that's a good.
Yeah, that's it. That's it. And you can go, there's a Sears, I've seen them as low as $89 on sale. There's a company called National Allergy that has a 10% off coupon, and it brings it down to $112.50. And I don't have ties to any of these companies, but that's it. You just do that in vitamin D today, and you won't believe how it will keep you safer against mass spread.
So
and then don't go in. Carry one of these with you everywhere. Do not go into buildings that are not 50 and above. Now, you can go in for a minute or two, because you've got to be COVID. In my view, COVID does not spread person to person. So it's not like if somebody coughs on you, you're probably not going to get COVID, because, and I meant to mention this earlier, very important. The only particles that get down deep to the ACE2 receptors in your lungs, where the COVID enters, are submicron particles. Micro droplets do not go down deep. They get stopped up high. So when you go into a viral cloud in a building, the person that's putting out that virus, they may have left 10 hours ago. It's not like someone is like throwing a baseball or throwing a particle at you that you're receiving from them, from a cough. It's just you're walking into a viral cloud, and there's nothing you can do about it. You cannot sterilize buildings. You can't, unless you want to make the building like an outdoor, where you open all the windows and it's 20 below outside. But even then, it's not practical. So you have to lower vulnerability by cell-mediated immunity. That's it. Simple.
So I wanted to ask you real quick before we get out of here, as we're starting to get to the end. Sorry to cut you off, Mike.
Yeah, no.
As we mentioned, well, I guess we didn't mention this when we were recording, but we were talking prior, and I had just mentioned to you that my oldest son has actually come home with this. He was exposed to COVID at school in what they call a mask-to-mask transmission, and meaning both he and the person who supposedly gave it to him were wearing masks. No. So what I wonder now, luckily we've been blessed and we're relatively symptom free at the house. We're of course on quarantine now, trying to keep our sickness to ourselves. But does all this stuff with relative humidity or absolute humidity and all this stuff to do with vitamin D and all this, like, is that a proactive something that you should be doing, like even in the throes of this thing or even during?
Absolutely. Everyone should do it today. Right now, today. Okay. So with regard to, let's say you have COVID. Vitamin D is extremely important to mitigating the bad outcomes. So if you go into a hospital now with COVID, one of the first things they should be doing is giving you vitamin D supplementation. And if you're low, they should give you, it might even consider IV vitamin D. It's really, really important because it has multiple levels of impact. It's not a vitamin, it's a hormone that is an immune modulator, and that affects cell-mediated immunity, affects humoral immunity, affects all kinds of things that will lower your risk. If you get vitamin D when you go into a hospital, the risk of going into an ICU is way, way down, and the risk of dying, it's like 2%. If you don't get vitamin D, I think there's a big Israeli study that shows 50% of people can be hospitalized in the ICU. So vitamin D is very important. Everyone should get tested, children included, 50 to 60, ideally 55 to 60. And there's a safety margin because it takes a while. You have to take a lot of vitamin D for a long time to go into the range where it's too high, which is above 100. So what we're talking about is standardized. It's validated by the American Endocrine Society. It's safe. It's like the American Heart Association for glands. So,
you think that even if a person is already sick, it makes sense to be doing these sorts of things as sort of precautionary?
No question.
Okay.
No question. You need to be 50 to 60 from here on.
So I'm looking on Amazon right now for vitamin D, just because I wanted to see what price point is on this. They've got regular vitamin D and vitamin D3. Is there
D3? D3,
okay.
and I'm buying we have Costco. You can go online. They've got a great price. First, I won't even go into how much I'm taking because when I was low, I've upped it, and I have to get retested. But you can get it costs next to nothing wherever you buy it. Just buy vitamin D3, and that's it. But get tested, and you can, as we talked about, go online on Amazon and for $69 get a test kit that will be shipped overnight to you. Get tested. Every workplace should test everyone on their staff, because if you have one sick employee, I mean, the cost of that person being out, the demoralization, the quarantining of other employees, the risk to your reputation, the healthcare cost, I mean, we can go on and on and on. Vitamin D testing now, it'll make all your staff safer and feel safer. And that's critical during this time. So that and humidity, those are the two things. And everyone should go on City of Roma, COVID-19. You can see Visualizing Hope. This is going to be in the news. New York Times called me yesterday. People around the world are starting to look at this. It is the future. And it's a grassroots movement that has nothing to do with politics. It's basically, we're relying on mothers in one of the poorest counties in America to say to all of this politicization, basically, to give the middle finger to it and say, we're doing what's right for our families and our kids, and there's nothing in the world that's going to stop us.
Yeah. I think what I like so much about your message is that it does sort of give you a little bit of hope. I think anybody who's paying attention, despite the politicization and everything else, like we all sort of know in our gut that, masks aren't the total solution. Sticking up a barrier between me and the guy at the grocery store maybe isn't the solution. I mean, I think we all have kind of this gut vibe, and, especially if you watch the numbers or you read into any of this stuff. I mean, you look at it and you go, okay, well, we did lock down and people didn't stop getting sick, and now we've done this or that or the other thing, and so I think it's good, I guess, to feel like you could do something about it, because there's I think this
control over your life.
Yeah, I think that there's just this fear and trepidation out there, sort of society at large, that when we feel out of control, it lends to this fear, and that can sort of start to feed some of these diseases of despair and some of these other things that are rising right now. And I think it is important to just give people sort of a ray of light. And maybe we're oversimplifying or making it feel so simple, but I mean, it really does feel like something attainable. Like you can go out and actually impact this today.
I mean, if they can do it in Bangladesh and Haiti, believe me, there's not any training, education, no one's spending a dime. It's happening just because of absolute humidity in the air they're breathing indoors. So just in summary, don't worry about outdoors. It doesn't spread outdoors, period. with regard to all the masks and the social distancing, I'm not even going into that, because what will happen is that will fade away once we get enough places, public buildings that have absolute humidity, that we'll see that within 2-3 weeks, mass spread will go down and stay down, even in the most dangerous parts of the year. And people will realize that they have not been told the truth. And they haven't from the beginning of the crisis. This has been, but that all I'm asking people to do, I'm not saying don't use masks or don't social distance, do whatever you want to make you feel safe. But I'm saying it's critically important to see danger differently and to question everything. There needs to be checks and balances on every single thing that authorities ask us to do. If there are not peer-reviewed studies to authenticate all these things, you have disaster. And that's why, I didn't tell you this earlier. I'm glad that we're going to end with this, not start with it. So France is a bellwether for what's happening here. 3 days ago, they hit 86,500 cases. If you adjust that for the American population, that's 441,000 cases per day. Last night, we hit an all-time high. It was 142,242. And a month from now, we will likely be seeing 500,000 to 600,000 cases per day. The hospitals are going to break. The infrastructure is going to collapse. There's going to be fear and panic everywhere. And they're going to continue because they never did know why COVID mass spread occurred. You can ask people to go indoors, but unless you tell them how to be safe indoors, all you're doing is changing the pattern of spread from large public spreads in public buildings to spreads on a different velocity, but still happening because you have a critical mass of virus in families, in homes, in people indoors, and they will spread to other people. So America is about to explode. We are going to have 6 to 7 months where the numbers go like this, because as it turns out, when you look at the viral safety index data, and it was never possible until August 3rd when the cooperation of the Draper Utah company helped me to create the first ever visualization of viral safety in the world. And I say that humbly, but it's true. You can look and see the last 12 months in cities all over America, and what you see is that from coast to coast, north to south, even places like Houston, that we have more than 50% of the days right now and through May in most places, and sometimes June, where the air is Wuhan and worse, at least 50% of the time, in some places 100% of the time, like Seattle. Last year, 100% of the days for 6 to 7 months were Wuhan and worse. We are just beginning. When COVID hit in the springtime, in the end of winter, okay, what they didn't tell us, the reason that we didn't need the Javits Center and the comfort chip and the ventilators never got used and the hospitals emptied out, they never told us that it was because spring weather is antiviral. It's been known for years that humidity indoors is a non-pharmaceutical antiviral, and that's what happened. It wasn't any public policy, or by and large, it wasn't public policy. Initially, it was important to do the lockdown because at the very early outset of a viral spread, before you hit critical mass, you can mitigate mass spread. But once you have critical mass, all you're doing is sending people indoors and changing the velocity, but it still explodes. So we're looking at 6 to 7 months of a COVID national security threat, a COVID nightmare. And everyone must take this seriously. And if we do, we can reopen safely and get our lives back. And if we don't, we are looking at something that is beyond anything anyone can imagine.
So I hate to bring this back to me and my career and my job and what
Please
I
do. That's what counts.
I'm a DJ. I rely on nightclubs. I rely on weddings. I rely on people getting together, dancing and having fun for my income. And I don't I don't think I can just walk into a nightclub with a humidifier and be safe. I don't know. I mean, like, could I bring 3 of them in, set them up 2 or 3 hours before I start, and feel relative comfort before I go into this?
No, this is not relative. This is not relative. This is not a crapshoot. It's not a roll of the dice. It's a number. If this is 50 and above, chill out, get your life back, live, have fun, be normal. And so here's what I would suggest, Mike, that you do, and that everyone listening, think of who you know in a decision-making position, in an organization, in a school, an industry organization, a large company, a restaurant association of bars, and get them to call me. So people can go on LinkedIn, and I'm saying this altruistically. Yes, I'm doing consulting, but this is, right now I'm the only person in the world that is offering this, and that is trying to do this. And I want people to be safe. If there are churches that are on a limited budget, that no money, call me, I'll help you. We need to get our lives back. And the simple thing is, we need as a society to make indoor air safe. So there's a logical approach. It requires some education and very simple measures that are not costly. And so what you need to do as somebody who reaches a lot of people, and both of you, please, with your podcast, is to be true change makers, to be thought leaders. I mean, that's what podcasts are about, is thought leadership. This is a thought leadership moment that is like life and death. And you need to be evangelists. And it's that simple. And you can go online to my LinkedIn site. There's lots of material. There are videos, there's documents, there's data. All this stuff is, it's not secret. It's not hidden. And there's no political agenda. So, but the biggest hope is visualizing hope, showing America how to reopen safely by going on offense against the virus. Imagine a month from now, if communities all over, if mothers are not going to go into places where their family is not safe. And there are no politics that are going to stand in the way of that. And that's where we have to, as a grassroots, people with no right or left, say we insist on safety and doing the right thing, and there is no compromises, there's no BS, there's no selling anything, there's no, we need you to do this: school, restaurant, bar, hotel, convention center, or else we're not going to go in. And that will change everything like that. Does that make sense?
Yeah.
Yep, I think that's great. And I think it's a great place to sort of put a pin in this conversation. Can we, I guess, just one more time, can you tell people where they can find out about the stuff going on in Roma, maybe track you down personally, and how they might get in touch?
Okay. So, City of Roma, it's Roma. Roma, just type in Roma, Texas, go to the city website and click on the COVID-19 link. And there you can see science, you can see some videos, there's contact information, but it's very simple. You can also click on the viral safety index and in Roma, and then toggle over to Salt Lake or California or wherever you are, and you can see what your risk is. If it's not green outdoors, which is 10 or above, then you need to really be thinking about your risk indoors. And then you can also see in my materials what you need to do, with whole home humidifiers or with your HVAC system, and then the vitamin D is just a matter of we talked about going online on Amazon, for example. You can buy a test kit for $69. They'll overnight it. I don't have any ties to any of these companies. And just get your level to 50 to 60. It may take a month or more to get your level up. So please do it today, not like maybe today. Today, start today, get tested tomorrow. do it now. And I'm talking to you, I don't mean to be so in your face to your audience, but I'm an ER doc. We're at the bedside. We're all in an emergency. And I'm passionately trying to save your life and to help you. That's it.
I love that. Well, thank you so much. We really appreciate you coming on here. I think this is really important information, especially right now, given sort of our political climate and also just sort of the climate as we're starting to move into winter and things like that. So I think it's really important information you're sharing.
Yeah,
Great.
Thank you for your time, Dr. Gusky. We really appreciate it and wish you the best.
Yeah, thank you.